Bob, so the Elucid platform and the concept and eventually the evidence-based end of it, how does that change the way you practice medicine? Does it give you a more personalized precision medicine to practice from a prescription, whether it's a drug, whether it's an intervention? What do you see this in the next year or two, whatever the sort of timeline is? How is this going to change you as a clinician? What does it mean to the patient? And then we'll get into the FDA in another time.
Well, for me, it's game changing. And since cardiac CT has come to the forefront, and since I have become interested in cardiac CT, it's definitely changed the way I've diagnosed and treated my patients. Early on, we, as has been said by doctors Shaw and Stone, we went with an ischemic based approach, i.e., stress testing. Well, we know that stress testing is not diagnosing the presence or absence of coronary disease. It's diagnosing the presence of ischemic inducing coronary disease, or tight stenoses, shall we say, or physiologically significant stenoses. Then came cardiac CT, which for many years I've been using as my first line test for patients with symptoms where coronary disease or angina are in the differential, because it's going to not only diagnose non-obstructive as well as obstructive coronary disease, but it's also now, and it also has an amazing negative predictive value, as has been said. But now, with the onset of Elucid and FFR and plaque characterization, et cetera, it's now becoming more accurate on the positive end. So its positive predictive value is improving as well. So when I talk to my patients, I look at it like this. Coronary CT angiogram is going to do two things for you. It's going to, number one, it's going to risk stratify you. Number two, it's going to make a diagnosis. And not only does it make a diagnosis of coronary disease, but potentially other non-coronary causes of chest pain, or even non-cardiac causes of chest pain. But now with Elucid, CT-FFR, and plaque characterization, it may lead to more directed, aggressive, isolated treatment options, so-called concierge type options for individual patients based on the risk characteristics of the plaque that we identify. So I think it is revolutionary. And I think that it's extremely exciting what is being done by Elucid and by those that are in the research areas of this, such as Dr. Stone and Shaw.